Hi, I'm Jerry Hesch. This is a lumbopelvic hip workshop in Virginia City, Virginia, and we have a PT named Danielle.
Danielle.
Danielle?
Yes.
Oh, good. Nice to meet you, Danielle. Her name is also Danielle. I like you. How long have you gone by two names?
Just one.
Danielle. All right. So we've treated Danielle. Yesterday we treated her wrist, and today we're looking at her lumbopelvic complex, in fact her whole body. And I asked the audience, do any of you feel like you have a bilateral anterior ilium hyperlordotic lumbar spine, or bilateral anterior tilt, however you want to describe it? And she volunteered. And in fact she does have such. So I will demonstrate my findings with her, and we're going to just keep her face out of the film. And it's interesting for her to describe how she responds to this. Of note, she is young, healthy, petite, and was a dancer for 16 years. So let's show my findings first, and then we'll let you describe your symptoms, okay? So we won't film her face. Let's have you lie down, please. No, just move it away. Yeah. So let's focus now on the pelvis. So when I attempt to test normative passive rotation posteriorly, which I think is a whole pelvic phenomenon, I don't really believe that this represents ilium rotating on sacrum. You know, we could argue till the cows come home for or against, but I'm not going to. But there's no mobility there, okay? This is someone who is very flexible, lots of hip flexion. Could you lie, and she does have normative pelvic side glide. Could you lie on your stomach, please? The ilia do respond with anterior spring testing. However, inferior, there's no inferior mobility. There's no play. There is superior play. She has very good hip mobility in all directions. Sacrotuberous ligaments are very tight, okay? Sacrum has a forward bent predilection, does not have play in a backward bending context, and L5 is probably at end range of extension, but L4 has mobility, okay? She does display pretty good mobility through the rest of her spine, a little bit of thoracic tightness, and when I test the upper cervical, she is stuck in hyperextension in the upper cervical spine, has a loss of accessory motions, which I won't demonstrate here, but you said some interesting things, and you said that you couldn't chew food, you couldn't put sushi in your mouth, you couldn't open your mouth wide enough. When you say ah, you get an audible pop and you're very, very sore. When did that happen?
I've had it since I was very young. I'd probably say like middle school, 13, 14, and they put me in a full set of braces, upper and bottom, with lots of bands on only one side to move my jaw. They said my jaw was unbalanced. And it took away some of it because it used to lock shut where I couldn't even fit a straw in my mouth. So they, after I had the braces, I could, but I still had to cut my food in small pieces.
Very good. And so your upper cervical is hyperextended, and that will alter some of the jaw dynamics. I don't know if treating your pelvis and giving you more mobility there will improve your jaw function, but it's worth trying. It will reduce the need for your body to reflexively hyperextend at the OA junction. And you have no accessory motion at the OA, none at C1, but you have accessory motion C2 and below.
I get headaches.
Yes, you get headaches and you get jaw pain. Can you tell us about your energy level?
I'm 23 and I have to go to bed by 10, no later. I just can't. I start to not feel good. I start to get a headache. I start to feel nauseous. My vision starts to get blurry. I just get exhausted by like, starts to come on around like 7, and I have to go to bed at like 10.
And I mentioned that you lack some peripheral motion because you have that lack of reflexive side rotation. When you hit heel strike on the right, your your head rotates to the right just slightly, but because it's hyperextended, it lacks that motion. And so I suggested that you have reduced peripheral vision, not because you have an eye problem, but because you have a mobility problem. And at that point, you said something.
Yeah, I recently got a new car, and I was, cutting people off left and right. And so I thought the mirrors were too tiny. I thought it was the car. I bought the little special, blind spot mirrors that you can stick onto your mirrors to help me see more of the car, because I felt like I was constantly going to hit people.
So you've left lots of bodies in the road? We've read about you. You're famous. Okay, so we'll stop filming and we'll treat you and we'll see what we can accomplish.